I would like to welcome you to the SafeHabitus webinar on understanding the number of injuries in EU agriculture. And this is the second SafeHabitus webinar that we've had in the past few days. We will be having a third, and I'll mention a little bit more about that a little bit later on. In terms of some housekeeping today, before we start, this webinar is being recorded, and the recording will be made available on the SafeHabitus YouTube channel in the coming days. I'd ask you to please keep your camera off and your microphone muted, and to submit your questions using the Q&A function. So we'll be keeping an eye on those and answering questions in the Q&A section at the end. And you can also use the chat function for comments interaction with everyone else who is online with us today. In terms of just a brief introduction, my name is David Meredith. I'm the leader of the SafeHabitus project, but we're here today to listen to our colleagues who are working on this project. And first up, we will hear from Mart, and Mart is going to talk about some of the findings from analysis that he and colleagues in the Estonian University for Life Sciences have been undertaken to explore what can we know when we use the officially available statistics, but what are the limitations of those data. And then we're going to hear of two case studies, one from Finland presented by Risto, and another from Ireland presented by my colleague John. And the reason for these two presentations or case studies is to highlight what can be achieved when we have good data, but also to highlight how different data collection systems can produce very good quality data. And finally, then, we are joined, I'm very fortunate to be joined by Matthias, who's a policy officer in DG Agri. He's in the social sustainability unit, and he'll be moderating the Q&A session. So in terms then of, these are our various presenters, so you will see us all in due course. But just to put a slight bit of context on today's seminar, for those of you who are engaged in this area, you will all be aware of the fact that the EU published the Strategic Dialogue on the Future of Agriculture last week. And within that, there's a recognition for the need to improve pan-European data on workforce and working conditions for farmers. And this is really where this research fits in. We're trying to understand what data are available and how they can be improved. And we'll see more about that. And to coincide with today's webinar, we will be publishing a statement of support for the EU Strategic Dialogue report, and that will be available on the SafeHabitus website very shortly. So on that point, I would like to just, before we kick off, highlight that we will have another webinar this coming Wednesday, and this will be focused on keeping children safe on farms. And just to note that if you did miss our webinar last week on occupational stress in farming, you can catch up on that by going to the SafeHabitus website and watching the recording there. So with that, I'd like to thank you all for your attendance. And I'm going to hand you over now to Mart, who's going to give us the first presentation. Mart, over to you.
Yeah, thank you, David. So I will start actually from the overall findings of our study and then continue to what are the problems of the system that we have at the moment. So our study indicates that the current reporting covers slightly over half of the fatal and non-fatal accidents, leaving some 40% underreported. And the root cause of this lies in the EU's failure to recognize the unique nature of farming where the majority of labor force actually comprises of self-employed family workers. However, since the reporting of accidents involving of these groups is voluntary for the European statistics of accidents at work, a significant proportion of farm accidents remains underrecorded. And as Matthias Fritz has aptly stated, what goes unreported goes unfixed. When we examine the death rates, the farming shows fatality rate that is over 2 times higher than the average of all sectors. And this is no surprise for those who have done anything related to safety in farming. As we know, there are animals who are unpredictable, heavy machinery, long working hours, and also aging workforce. Meanwhile, if we look at non-fatal accidents, we don't see much of a difference, which should raise some suspicions. Why is it so? In our data collection and reporting study, we estimated the number of accidents first by grouping together member states with similar types of farms and farming practices, and then used higher quality accident data reported for 1 or more member states in each group to use as a reference point and to calculate the estimated number of accidents. And essentially, our estimate is about 30% higher than what's currently reported. Grouping exercise essentially revealed that there are both geographical and cultural factors that influence farming practices. These factors, along with the historical influences, also affect the accident data, as the accident reporting and collecting system are somewhat similar, and also the reporting culture tend to be similar within the group. However, it's noteworthy that when we compare the distribution of reported non-fatal accidents on the left and the distribution of farm labor force among the groups, then there are quite significant dissimilarities. And if we take this into account, then we also see that when we base our estimates, what's currently known, then we are still essentially victims of the same system that there is. We are quite sure that this estimation is closer to the real picture than what's currently known. However, there are still things that can be improved further on. Challenges that we have, or what the European statistics of accident work has, are actually well known and documented. However, it's important to acknowledge that these issues disproportionately impact the farming sector data. And I will try to explain why is it so. Firstly, reporting accidents involving self-employed family workers is voluntary for European statistics of accident at work. Meanwhile, the vast majority of farm labor force comes actually from the households, as is illustrated in this figure. However, we also notice that the difference in the shares of the family workers is also quite big. Meaning that only a handful of member states here in the blue group are the countries where the workforce is mainly composed of non-family members. This is essentially in a stark contrast to what European statistics on accident at work coverage on the self-employed and family workers has. We essentially see that only half of the member states have accident collection system that cover these key worker categories. However, if we examine this even further, then the picture becomes even more complicated. And especially when we consider how the incident rates are calculated. Calculating incident rates requires a reference population that corresponds to accident data collection. Although European statistics on accident at work allows member states to provide reference population from their own administrative sources, often European labor force survey is used instead. And to understand how well the reference population fits the accident data collection, we have combined data from the Farm Structure Survey and European Statistics on Accident at Work metadata, and extracted reference population from the non-fatal accident database for each country. We then constructed a stacked bar chart showing the proportion of the key farm labor force categories. And this is this bar chart here. The colors, which we use in the next slide, refer to whether this group is included in the data collection or not. We also mark down here the reference population value. So keeping this in mind, on the next slide, there are all the member states, the distribution of the key labor force categories, whether those categories are included in the accident data collection, and where the actual reference population value lies regarding this distribution. Essentially, if the country promises to collect data from all key labor force categories, we would expect the circle that represents the reference population value to be in the very end of this chart. That would be in the case of Austria. We would expect the circle that represents the reference population in the very end. However, it's somewhere in the middle. The opposite we may maybe observe in case of Bulgaria. For example, they promise that they will only collect data from high workforce, and they deliver based on that. However, we see only a minor number of countries where the expected location of the reference population is in agreement with what the data collection system promises. In addition to that, the accuracy of incident rates and reference population is further complicated by apparent inconsistencies in the reference population data. And to illustrate these inconsistencies, we have also constructed time series of non-fatal accidents data trends for each of the member states. On this slide, I try to explain what those timelines show. In order to keep those time series comparable, we scaled all those in normalized scale, And the reference year we used for normalization was year 2014. In some cases, we see some anomalies, meaning that the incident rate changes rather because of some misunderstanding in the reference population. And what I mean by that is this chart here. Incident rates are here located on as the circles, number of accidents as plus, and the line here refers to the reference population. Essentially, the incident rates should be inside the, the pluses should be inside the circle when we see that the incident rates is caused by change in the number of accidents. We could expect that there are some quite big changes during the years in case of small countries. That would mean that when the population is small, then essentially it's more or less random whether there are few more accidents per summer or not. But we also see this kind of fluctuation in case of very huge countries. For example, in the very bottom left, we see Poland, or two charts to the right, Romania, where in 1 year, that is in 2019, the reference population that was used for incidence rate calculation was significantly higher than the years before or after. Obviously, this is some kind of human error or communication error, but this kind of issues exist in data. And as long as these anomalies persist in the early data, we should be quite cautious to use each year's data separately. Rather, I would recommend that we take some averages over a few years. If you look at the underreporting, then our inquiries to member states indicate that primary reasons for the underreporting of non-fatal accident data is lack of incentives for reporting them. And this is particularly evident in member states without an accident insurance system, where the amount of sickness benefits does not depend on the circumstances of the accident. And the figure here illustrates each member state based on two dimensions: the incident rate of fatal accidents on the y-axis and the incident rate of the non-fatal axis. Sorry, on the y-axis is the non-fatal accidents incident rates, and fatal accidents incident rate is on x-axis. The figure is further divided into 4 categories by the weighted average of the whole European Union. And from this figure, it's actually evident that member states with accidents insurance system tend to report above average rates of both non-fatal and fatal accidents, mainly though non-fatal accidents, except in few cases where I would say there's a problem of how those data is actually reporting to Eurostat. For example, Poland actually has national statistics that shows significantly higher incident rates. And we also try to look if you look the same picture, but based on the member states categories of having similar agricultural system or practices, then I would still say that this is not more informative, as it's likely that what's actually explains it better, the picture here, is still the existence of the accidents insurance system. Because countries with which are having here in our study similar agricultural practices are linked geographically or culturally, and those also tend to have similar reporting system. So what can we do about it? And obviously the issues that were highlighted here are the issues that we need to solve. Firstly, difference in the coverage of self-employed and family workers among member states. Those are different. The main issue here is that so far there's serious doubts whether the reference population data and the accident data collection system collect data from the same groups. Essentially, the first issue that needs to be solved is that those populations have to match. In order to do that, probably we have to recognize the unique nature of farming among other subsectors of NACE, meaning that those data sources that don't collect information about farmers that are self-employed or family workers that do not suit farming incident or accident systems the best. You could also probably ask the member states to provide or obtain members reference population data from some administrative sources that could be likely helpful. And what we can also do is to first get data from some population that we very specifically know where the data is coming, and then extrapolate this data for the whole population. Secondly, there are accuracy issues with incident rates in reference populations. And here we really have to once again address the reference population issue by incorporating the self-employed and family workers into the data collection system. Otherwise, we will not get the true picture of it. And one way to do that would be collect accident data and reference population data simultaneously or from the same source. And there are several options for that. For example, we could integrate accident data collection into existing surveys that collect farm data. For example, farm structure survey or agricultural census can include questions about accidents in the farm sustainability, in the farm sustainable data network. We have made some progress regarding that. Or we could introduce a completely new survey, called farm accident survey, or utilize the occupational safety and health barometer. For underreporting, one of the potential but quite costly solution would be implementing a mandatory accidents insurance for farms of a certain size. This would add an incentive to report and also enhance the quality of the data we have. However, we should first study whether this option is feasible and consider both the associated costs and benefits related to it. Thank you for the attention.
Thank you very much for that, Mart. So what I'm going to do is pass over to Risto, who is going to give a presentation that highlights exactly what Mart was just talking about there, the benefits of a social insurance type system. So just as a brief introduction, Risto has a long track record of working on issues of farm safety and also farmer health. Many of you would know that he led the EU Cost Action Securima, which was really the predecessor to the SafeHabitus project. So Risto, if I hand over to you, you can take it away.
Hey, yeah, thank you, David. Thank you, Mart. Let's see, I think I have to put this in a presentation mode. I think you can see it now. Yep. Okay, yeah, this case study comes from Finland. So we will look at what the data can look like if you have a social insurance system, accident insurance system for the farming population, and then what you can do with that kind of data. So Finland has about 50,000 farms currently, and the farm owner operators are not covered by occupational safety and health laws, but they do have an extensive social insurance coverage. Two of the key programs are a pension insurance system that was started in 1970, the main program now that we talk about is the accident insurance system, which has been in place since 1982. Accident insurance, like for other occupations or employees in other occupations, and also employees in farming, these insurances basically compensate injury and occupational disease costs to the person who is injured or has an occupational disease. And these systems also produce statistics sort of as a side product, which actually is a major part of the insurance case adjudication. And also, typically, these types of insurances provide, or they save some of the costs for prevention. So in this system, 1.75% of the insurance costs are used for prevention and funding research and outreach activities. And employees in agriculture have had a similar insurance coverage for longer than the farmers have had it. So practically all farmers with some age and farm size limitations are covered, and this is a mandatory coverage for those farms that meet these thresholds. And those who are potentially smaller farms, they can also take these insurances on a voluntary basis. And the employed workers have also basically the same rules as employees in any other occupation. And the data from these systems is handled a little bit differently. For the employees insurance system, there's many companies who actually provide the insurance coverage, and they send their data through the Finnish Workers' Compensation Center to Statistics Finland and then to Eurostat. The farmers' insurance is actually a specific company, public-private company that is set up by law, and they basically have a monopoly on the accident insurance system, and they send their data straight to Statistics Finland and then Eurostat. The data has a lot of elements that are coded. Sorry about the dogs. You can probably hear them. You can see the different types of elements that are coded. Some of my favorite ones are underlined there, being work activity that was being conducted at the time of the injury, the cause, what is determined to be the cause of the injury or occupational disease. Then incident description, about 6 lines of text for each case So these can be pulled from the data and getting a little bit more descriptive information what actually happened when this injury happened. Then if the case is fatal or not fatal, and to estimate the risk, there is two key elements, lost work time or compensated lost work time, and paid benefits. So we can get for each case an accurate account of what the cost and lost time was in each case. The data elements can be looked at in many different ways. Here are some trends. You can see in the left top corner the number of insured farmers, male and female. And you can see, I think, a typical situation where in almost every country, the numbers of farmers are going down. The top right shows the injury incidence rate. And if we look at this rate and we look at the rate that Mart showed earlier, this rate, although we use different denominator, we use 100 injuries here instead of 100,000. This would be about 4 times higher rate than what is the average rate in EU. And that can indicate a little bit what the underreporting level really is in EU. The trends can also be used to look at emerging issues. For instance, the number or share of machinery has been going up. It is still only about 20%, but going up as the farms become bigger and more mechanized. So that is a clear trend. Occupational diseases, the numbers have come down. There was a high peak in the beginning of the insurance system in respiratory diseases. That was potentially caused by starting to use baling systems and getting a lot of bad quality hay and straw and other natural materials, which can become moldy if not stored properly. And so there was a huge issue with respiratory diseases, farmer's lung especially, but that has been getting better lately. Not all injuries and occupational diseases are the same in terms of their severity. This slide shows the numbers of cases from 1 year for fatalities, and then basically very long-term disability cases, and then down to no compensated days at all. And you can see that the numbers keep increasing gradually towards minor cases, where then getting into that 0 to 6 days and 0 days, the incentive to report is not as great. These may only be 50, 100 euro cases. So there's no incentive for farmers to really make a claim for very, very minor case. A lot of the information we use for prevention in agriculture is based on fatalities. And that's something that where the data is quite a bit better. But the ratio of fatalities versus non-fatal injuries in insurance systems overall, not only this one, tends to be about 1 to 500 or 1 to 1,000, somewhere in that range. So in this insurance system, for each fatality, for one fatality, there's about 500 non-fatal injury cases. So it is very important to understand the non-fatal injury cases also. What is causing them? How do they look like? What is the economic value of them? And so on. Other ways to look at the data, this bigger slide piece here is about the accident causes. On top, there's several types of machinery, and they represent about 20% of all cases, but the animals, structures, working environment, that's where the bulk of the injuries are. And there's a categorization in this insurance system that has over 100 more specific codes, which could not be easily presented in a slide like this, but they're available. Work activity, so crop work, animal work, and then should not forget forestry work. A lot of farms in Nordic countries have forest, and they do a lot of that work themselves. And then also farmers tend to maintain and build their buildings. And that's another hazardous work activity that we should remember when talking about what kind of injuries farmers have. Affected body part, 2/3 involve limbs. We can do some very advanced studies from these data. This is from one study where we looked at the risk factors for accident and occupational disease. And so when you have data on not only those who are injured, but also those who did not have an injury, then you can do these risk factor calculations. So so these numbers are like 1.3 means 1.3 times greater risk of having an injury if you are in the oldest versus youngest group. 1.7 times higher risk if you're a male. Interesting issue in Finland. Swedish-speaking farmers are safer than Finnish-speaking farmers, although there shouldn't be really any real reason for it, but that's what we see. Farm income, the greater the income, the greater the risk. Farm size, the greater the farm size, the greater the risk. And these are from multivariable models, so these are actually already adjusted so that these are basically the contribution of this variable alone. Different types of crops and animals, how they increase their risk, the risk of injury, the presence or absence of this type of production. So those types of things can be used when looking at where do you want to put your prevention euros, who are at greater risk than others. Also for activities in outreach and extension, advising, or other ways of communication, we can look at geographic areas, municipalities, for instance, and we can see that the injury rates are different depending where in the country you are. This slide shows the insurance costs for the whole country in millions. So about 25 million, a little bit over, or getting a little bit smaller for the accident insurance for work accidents. Leisure accidents are covered also in a different way, and that seems to be a much smaller piece for farmers than work accidents. Occupational diseases are about 1/4 of the cost of occupational injuries. And then let's see. Okay, if some country wants to start a system like this, this could be perhaps an interesting slide to look at how the insurance costs happened in Finland in the first years when the insurance system was started. And overall, the medical care is not a very big portion, only about 15-20% here, while the purple part is lost work time during the first 1 year of the case, and then the yellow one is the compensation for long-term disability cases, and then other types of benefits are on top of that. And this, I think, has continued somewhat stable since these early years. Then some of the policies and programs that have been influenced by the data, some of this has started already earlier. So just anecdotally, tractor overturns were recognized early on, and Finland started a ROPS requirement on new tractors in 1969. The pension program that was mentioned, relief worker program since 1974. This was mainly to help especially farm women who did most of the animal production work, and providing some relief for getting a break from the very hard animal care work. Agricultural occupational health services is a major investment in Finland into agriculture, health and safety, started in 79, then the insurance system 82. Early on, the insurance data started showing this thing that buildings and structures and how animals are cared for is a big issue. And so we had a project that looked at safe building designs, and then several other programs have been influenced by the kind of data that we have had. And more recently, we have sort of done more international programs, including the Sakurima and SafeHabitus now, just to broaden our funding base and ability to learn from each other. One major program in Finland still, I think, has been creating attention also in other countries, is to support the farmer mental well-being, basically vouchers for services and other ways of helping farmers with difficulty with their mental health issues. Few more things, how we respond to what we see in the data. So early on, attention not only from looking at the fatal injuries, but also looking at the non-fatal, which are by far the prominent issue. Machinery, that's sort of an easy target because it's so easy to see and realize, what machinery injuries are like. But they are only about 1/5 of the cases, and so we really focused on the broader view of the accidents. The building project, the design project just mentioned, and the occupational diseases, they are a big issue. Not only injuries, but occupational diseases take a lot of farmers out of business, not being able to work anymore. And there are several innovative programs, including compensating powered respirators for farmers with respiratory diseases. And then it has been clear for a long time that the accident and occupational disease causes are extremely diverse. Almost anything can cause an injury. And you cannot possibly create a checklist or some kind of a overall program that will address all hazards. So we have sort of shifted they prioritize the safety mindset in terms of other interests, finances, other things that take most of your time and resources. But keeping safety high on your priority list and looking at the safety culture, that's sort of the current one of the current focus areas. And again, mentioned a little bit, what kind of research we can do from these data. So descriptive studies, analytical studies with fancier statistical approaches, intervention studies. We can look at if interventions have had an effect by looking at either before or after claims, or looking at control and intervention groups before and after. And so we can get very accurate data on if the interventions work, and then various targeted issues. So final slide, I think. So what are the benefits of having a social insurance-based surveillance system and data? So we have a well-defined population. Basically, all farmers are in the population, all hired workers are in the population. We collect the data for that exact population. So, and we can get accurate rates from a well-known population. There's a high motivation to report because there are financial benefits there. So the underreporting is low, and over-reporting is not a very big issue. We've tried to also look at if there is the sort of moral hazard of misusing benefits, but at least in Finland, I believe that it's not happening much. The system produces 2 accident rates, population-based data, includes injured and uninjured. This helps with the studies. Ability to analyze severity, work activity causes risk in many ways, looking at trends, emerging issues, and doing high quality studies. Also ability to link with other databases if the permissions can be obtained, and we have had several linkage studies. Ability to compare agriculture fairly to other occupations, and having the availability of reports annually. So that, I think, concludes my presentation. So yeah, back to you, David.
Thank you very much, Risto. That was a really interesting presentation. And I would just ask if anyone has any questions or queries or would like to find out a little bit more, put your questions into the Q&A and we will answer those during the discussion. But we're going to move from a social insurance-based system in terms of collating information and data. And we've just seen a really excellent example of how that data can be put to really good use. To a very different type of system that we have here in Ireland, and my colleague John is going to give us that presentation. So John, over to you.
Okay, no, thank you for having me, and I hope to add to what has been already stated. Let's see, let me load up my presentation. That, yeah, all good. Yeah, no, I'm presenting on, it's an Irish case and it's on behalf of all my colleagues. The initial presentation back in Brussels in April was made by Mr. Pat Griffin, who has been a senior inspector with our Health and Safety Authority and has since retired, but continues as a SafeHabitus Scientific Board Advisory Member. And myself, I'm the SafeHabitus Work Package Leader for Work Package 3. Right. I think the first case, I think, is straightforward. It's, we need accurate data. Why? To produce national plans and strategies. And dare I say it, at a European level also, we need such plans. And good data allows development of targeted interventions, and good data focuses on critical and emerging issues such as child safety or older farmers or that. So I think the key word in science at the minute is evidence-based, and we need good data for that. No, the opposite is an unsatisfactory situation, where there is poor data or inadequate data, or dare I say it, no data, and that leads to just recurrence of the problem and perhaps loss of resources as well, misuse of resources by focusing on the wrong issues. Right, in Ireland, health and safety within the agriculture sphere is probably really got going in 1989. We had the Safety, Health and Welfare at Work Act, which followed on just after the EU framework directive for occupational health and safety, and the two are very closely aligned in terms of their structure. But one initiative under that in 1991 was the appointment of an advisory committee to the Health and Safety Authority, which is the regulatory authority for health and safety. I in fact, have been a member of that since 1991. So along with all major stakeholders, we consult with the authority and we produce a national plan. We meet a number of times a year, but we are action-based in our approach. Now, we produce a national plan, as you can see there on the screen, and it has 5 working groups, and it has specific objectives, health and vulnerable workers, which Pat Griffin has chaired, behaviour, education and training, which I chair, and other ones, livestock safety, building and work at height, and machinery and hazardous, tractors and hazardous machinery. Now, we also in Ireland conduct quite a lot of promotion of health and safety. Now, the Health and Safety Authority carry out, in conjunction with our Department of Agriculture, regular campaigns, where they both focus on health and safety and inspect at the same time. There is a UK and Ireland Farm Safety Week in the 3rd week of July. My organisation, Teagasc, which is the Farm Advisory Research and Training Authority, we run major events to promote agricultural development, and we include health and safety on those at various times of the year. So, there are farm safety weeks, but there is a 12-month focus on health and safety. Right, where do we get information? Where can you get information? Just 2 studies from within the HSA. One is on farm vehicle fatalities review, and within the agriculture sector, they account for 51% of the fatalities, and 65% of the fatalities were 55 years or over. Now, they did an agricultural fatalities review, and that highlights that agriculture has 42% of all fatal accidents, and that 47% are due to persons over the age of 65, and 21 of the 208 fatalities were to persons aged under 18 years. Now, myself, along with colleagues, we conduct, research mainly related to non-fatal accidents, and, we have published. I've just put up 2 papers there from 2024. One is a paper, Mohammed Razi, Meredith and McNamara, which parallels this presentation, and it describes the health and safety surveillance data systems in Ireland. Another is a paper on identifying injury risk factors in dairy farms, again published in 2024, based on non-fatal accidents, which I'll refer to a little later. So moving forward, let's see, health and safety needs to be promoted.
Sorry, John, I'm not sure what happened there. That's a different slide.
Yeah, sorry.
There.
Right, yeah, I'll just skip on that. I'm not sure myself what happened. I just now want to describe what, tracking fatalities. basically the Health and Safety Authority are obliged to get all information. You know, once a fatal accident, our police, our on Gardaí, as we call them, no, they inform the HSA. You know, there is a legal requirement for the company or the to inform the HSA. But the bottom line is the Health and Safety Authority gain information about all potentially fatal workplace accidents, and they investigate them. And if they are occupationally based, then they produce a report on them. You know, this is the overall slide showing that 44% of the fatal accidents are related to vehicles. Let's see, 19% due to livestock, 14% due to falling loads, 7% due to machinery, and so on. Now, you know, contrary to other countries, we've been able to get accident levels down, you know, we're at a high in 2014, you know, and in the past year there were 16. Now, there's a wave effect on that. Let's see. I think, you know, 2014, you know, you had a lot of expansion in agriculture, a heavy load, fodder crisis, a lot of tractor movement and fodder movement, and the age of farmers. So we've got it down, but you know, keeping it down is the challenge. And you know, we feel that the wave effect is caused by when there's a high level of accidents, there's a huge media response to accident levels, you know, and lots of very good media coverage, which gets farmer behavior and interest and involvement in health and safety going, and that drives accidents down again. But you know, things move on and accidents may increase again, and the same cycle repeats itself. Right, just there's plenty of data and it's all available. It's on the health and safety websites, you know, but this is the fatalities by age groups, and I'll just highlight that 50% are over the age of 50 years. No, this is for young people you know, up to the age of 18, and I'll highlight that, you know, most of the accidents happen to are associated with vehicles. Right, this is a trend, and let's see, about 2016, the trend changed. Maybe I'll interpret the data from the bottom. The lowest line, the blue line, is childhood accidents. I'm glad, childhood fatalities, I'm glad to say that they've got to 0 for the last number of years. The red line is from 18 to 64, and they've shown a gradual reduction and a flattening out. And then the third line, the grey line, is for over 65. And since about 2015 or 16, they've gone up and they've remained relatively high. Right, regarding non-fatal accidents, it's a legal requirement to report them, but limited reporting takes place. So my organisation, Teagasc, and you know, myself being the leader of it, we've done non-fatal accidents with our National Farm Survey, which is, you know, a component of the European Farm Sustainability Data Network. And, you know, we've been doing it since 1992, in fact, but the last few years, so it shows the trend in accident levels. No, but, and the big trend is an increase in livestock-related accidents. You know, machinery accidents have gone down, although they were up on the last occasion. You know, trips and falls have gone down as well. Now, we have done a more recent version of that, and we found about 4,500 accidents take place. And you know, we know the length of time the person is out of work for, and we also know whether they were hospitalized or the nature of the medical treatment that they got. So we have survey data for non-fatal accidents in Ireland. Now, you know, what resources are developed on data and research? You know, we have some data with very good fatal data, and we have non-fatal data. But, you know, the health and safety carry out risk-specific inspection campaigns throughout the year based on data. You know, advisory and training, which is, you know, my organization and other organizations, you know, we focus on key issues based on fatal and serious accidents. You know, we use research to understand what is taking place in the industry and to respond to it, you know, to develop initiatives and road test them. You know, for instance, we've noted that within livestock accidents, you know, bull accidents have gradually reduced, whereas cow accidents have increased. Just to mention one thought. Now, we make lots of guidance material, such as videos, adverts, newspaper articles, you know, online, you know, media, you know, Twitter, Facebook, whatever, messages to farmers, and that we look out for emerging and future risks also. Right, we have a health and safety risk assessment document since we had a legislation in 2005. No, we used the data, you know, within this document, and you know, the document is very widely used, and we focus farmers on, you know, what is causing fatal and serious accidents, you know, in the risk assessment. No, regarding health, you know, we promote health very strongly, and you know, there are numerous documents, and we've used, you know, both farm accident data and also other research on farmer health, including mental health and fatigue, you know, to focus our attention in all these documents and media campaigns. Right, just to finish, you know, emerging or major sources of risks, I think, you know, vehicles is the key problem in Ireland. So we're talking about traffic management plans, speed and blind spot prevention. Livestock handling, as I said, accidents have gone up, so we're focusing on greater awareness and on specific issues such as cow attacks, falls from heights. I think with environmental progress, lots of people are putting up solar panels, but, you know, risk assessment while working at heights and roofs is an issue there. You know, health is a major issue for us, particularly mental health and poor mental health and suicidality. And crucially, you know, as the data shows, you know, elderly farmers, let's say, or older farmers over the age of 55 and younger farmers, younger children are particularly at risk. No, I'll finish. I think Pat Griffin is a very artistic person, so I think he took this picture, I believe it was in Geneva, and I think it shows the desolation of having let's say, a serious accident or a fatality, and the pain and anguish that goes with it. And I think it behoves us all to seek to prevent both accidents and ill health to the best of our ability. I'll leave it at that. Thank you very much.
Thank you very much for your presentation, John. It was you got through that really nicely. We're on time, so thanks to all of our speakers for sticking to time. Really appreciate that. So I'm going to hand over to Matthias now, and we will have a discussion and some questions in relation to the presentations that we've just seen. So Matthias, over to you.
Thank you very much, David. I think we heard some very comprehensive presentations using the words of yours on what can be achieved with proper data. 3 different very interesting PPT we had, and I would open the floor to you, to the audience. Please come and share your thoughts, comments, or questions. But before doing so, we have already 2 questions from Jarko, and I would start from backwards. The latest, as John is the last presentation, the memories and the information from the last presentation of John is still fresh. I would go in this direction. So Jarko raised the question: increased animal herd size may cause increase in injury numbers. Note that building maintenance accident increasing is also connected on bigger sizes and volumes on farms. John, I would leave it to you to answer it, but before, just one more question on my side, because we had some very interesting data in your presentation, just in order you can answer both of them. So in your presentation, you were, and also in the case study, you more or less mainly focused on the fatal farm accident. And you said you have survey data, by the way. It is related to the risk assessment document. This is my sub-question. But if I understood well, it's based on surveys, of course. So could you give more information on approaches in place in Ireland to gain more data on non-fatal accidents? And I'm asking also this because we heard one of the main messages of Risto on the importance of let's say, non-fatal focused approaches. So first, John, back to you with these two questions, and then we move forward with other questions. Thank you.
Okay, no, thank you very much, Matthias. Yeah, and I think I have 3 questions. I think Jarko has 2, and then your question as well. And we have noted what Jarko is explaining. As herd sizes get bigger, accidents tend to increase. What has happened in Ireland is our dairy sector has increased, in herd size, and that. We have seen an increase in accidents associated with this, both in terms of dealing with the livestock, but also other accidents, farmers having bigger herds and having more work to do and more machinery work and, more rushing around and, more overall work. So we have got the data, and we have explained the problem to farmers so that they can improve their management, of livestock. And there are 2 broad aspects to it. One is, improving facilities, having good facilities to handle animals. And the other area is in behavior with livestock, and both of those areas we're pushing on those. And the third area, which is very big, it's genetics or genomics, where you can breed for more docile animals. That is also a very important technology to use also. Now, while I've mentioned dairy farming, dairy animals tend to be habitated, and meet humans regularly, whereas beef cattle do not. So I think it is very important that we promote livestock safety among beef animals also. Now, I agree with Jarko as well. Building farm maintenance accidents, when there is active work which is hazardous going on farms, then accident levels increase. And, we would encourage, Irish farmers to use professional you know, people to both do buildings and to do maintenance. Now, obviously, farmers will do some of the work themselves, but you know, we want to make sure that they are competent and have the time to do it. We don't want any work which is poorly managed to take place, you know, especially with building works. Now, I will turn to your question, Matthias, which is about non-fatal accidents. Now, you know, quite a number of years ago, we realised that farmers, even though they have a legal requirement to report accidents, that, you know, they're unwilling to do so, despite a lot of efforts to encourage them. So what we commenced doing was a national survey of about, you know, 800 to 1,000 farmers under it's the National Farm Survey in Ireland, but it is the Farm Sustainability Data Network across Europe. So we ask a question, and it's totally confidential, and it's, you know, we ask farmers what accident they had, and they give us a brief description, and, you know, the medical treatment they get if an accident occurred, you know, what family member had it, what work days they lost. So we've built up quite a body of data over the years, and, you know, it's not total data, it's survey data, you know, but it gives us very good estimates of you know, the injury trends and it has collaborated with other medical sources of data and you know, just to finish, we have published the data, you know, we've published a number of papers on it, and, you know, we've calculated some risk factors as, you know, Risto described them. Okay, thank you for that.
Thank you very much, John. It was very detailed question. I had already some thoughts and comments, but I won't open my microphone from that perspective. But luckily we have other questions. So I turn to Mark now, as Jarko had an earlier question on how what role the doctors could have in this system or in this regime. So over to you, Mark.
Yeah, thank you for this question. Essentially, if the injury of an accident is great enough to have a doctor record, it would be beneficial to have it in order to increase the understanding of the absolute number of accidents that is occurring in our sector. On the same time, how sure can we be that the information related to this location of the accident is accurate enough to be useful? Is it happened in a farm, happened during attending animals? There are huge variability of what can be written there. And one thing that maybe could and should be explored is whether we could employ artificial intelligence for that, to extract this kind of information and connect it to other sources. Maybe this could be one option. Another thing is that the absolute number of accidents is only half of the picture. This allows us to have some understanding of the trend in one country, but we also want to compare countries. That would mean that we also have to understand how many people are actually working in agriculture. And sadly, there is no good picture for that in Europe at the moment. There are highly conflicting numbers. For example, Farm Structural Survey from 2020 said that regular farm labor force is 17.2 million workers. That also includes some very small farms. If we eliminate farms that are less than 5 hectares, that would leave us 13.2 million. If we compare what Labor Force Survey, for example, says, it says 7.8 million workers. And if we compare what the European Statistics on Accident at Work has said, or what we can back calculate from then on 2020, the reference population was 6.6 million. So there are huge differences of those worker numbers. And the question is, what is actually the truth? And will we ever have all the workers that are at risk covered by the actual data collection and reporting systems?
Thank you very much, Mark. As always, very comprehensive. We have a third question now from Maida on let's say what's happened after the accident, or with those who are affected with the accidents, and on family members and colleagues. So I would open for all of you, but first I would like to hear it from Risto, because he might have let's say best practice, at least in based on his presentation today. I see that they have a very developed system on safety system. So I would turn to Risto to first, and if others, Mart or John or David, you have also a kind of response, please go ahead. Thank you.
Yeah, there are several countries that have an accident insurance system, something like Finland. Germany has had one system for a long time. Austria has quite similar system as Finland has. France, few other countries. These countries have an organization called ENASP, ENASP. They meet annually, and that is one group of countries where information is shared about the kinds of social insurance coverage they have, but the rest, it is very problematic that if you have an injury, especially a serious one or an occupational disease, you may be in a situation where if you can no longer work at your farm is at risk of closing and being sold to others or rented or some serious situation. And but what this kind of insurance system, like in Finland, does is it basically determines an income level for each person on the farm. That's based on the size of the farm, and then that income level is used as the basis for providing compensation for as long as the doctors have decided that you are unable to work. If it is a permanent disability or a very long disability, it is typically assessed for some number of years or months ahead into the future at what level your disability is, if it's 100% or
I don't know if colleagues, you have sound, but I think we lost Risto.
Risto he's frozen on my screen. No,
Yeah,
could I
so
just comment, from an Irish perspective, I think, we have a universal system of social insurance that does provide help and support for, accident victims and that. Now, there is, a voluntary organisation which is farmer-led, it's called Embrace Farm in Ireland, which on a voluntary level gives very good support to, families who have suffered tragedies due to either fatalities or ill health.
Thank you very much. Mart, if you have anything to add, or I would go to another question.
Yeah, I think in my perspective, what Maida has highlighted is that with the accidents, there are hidden costs that are not so obvious, and first we have to really understand what is on the tip of the iceberg, and then we can proceed with dealing what's beneath the sea level.
Good, thank you very much. Short, but very, very straight ahead. But staying by you, I guess I would address the next question to you. Maybe you have any knowledge on availability of agriculture safety data about Egypt. This was the question, the Q&A.
Yes, sorry, I am not in position of such data.
Thank you. Then I don't know if David agrees, but if we could answer this later or in written form, or do you agree? And then we can turn to John. I see that you have some comment. Maybe it's not my role typically.
Okay, yeah,
to,
no,
to,
thank you.
to speak about this.
no,
But please go ahead, John, and comment on the FSDN plans as you foreseen it.
Yes, no, just to let the audience know that the Farm Sustainability Data Network, there are proposals to ask a number of questions, one related to accident causes, on farms, that cause out of work for 1 day or more. And there is another question on risk assessment. Is this completed for the farm? Now, there is a have your say. I've put I think I've put it in the chat, the web link. It's on Europa network. And, there is a consultation in place until the 11th of September, a few days' time. So that's related to asking those questions across Europe. Thank you.
Thank you to promoting our approach, John. Just to tell you that the existence of farm safety plan, it is the one let's say indicator or variable on the agenda, on the list. I hope, as you said, more as much as people as possible will vote and support these data needs. And the other one is, of course, the number of accidents on farm. I have a critical. I step out from my position a little bit just as a response on this. On the first one, on the safety plan, I'm more critical because the question will be answered with yes or no. It means for me as an expert, it will not give us any indication on the quality of the quality of the safety plan. But at least we will know that there is somewhere on the farm a half page or a 10-pager, which is already a good one step in the good direction. And let's close my both role here as an expert and the moderator. We approached our time absolutely perfectly, and we should have time for David to have the conclusions here. Thank you for listening on my side.
Okay, thank you very much for that, Matthias. Well, firstly, I wrap up very quickly. I want to thank all of our presenters here today. So to Mart, Risto, and to John for taking the time and preparing the presentations and presenting today, and for answering the questions. And that brings me to you, the audience. Thank you very much for your interest and participation in this event. Thank you for the questions. They highlight even though this is a very technical topic at times when we're dealing with data and indicators, what we see is the very human implications, the people behind these data that are injured or killed on farms, and these data are really, really important to providing an evidence and informing evidence-informed policy. So without it, it becomes very difficult for policymakers at a national level or an EU level to identify the types of actions that they can support and resource. So thank you to the participants, to the audience here today for engaging with this seminar and the really good questions that we had. And finally, for me, it's to say that our last seminar will be taking place this Wednesday, and it will focus specifically on children and safety on farms. So we have a really good lineup of speakers there. It has been organised with our colleague Maida, who you would have mentioned, would have heard about earlier on, but also other colleagues who are working with us on the project, including Florence McCoe from Penn State University, Sally Shortall from the University of Newcastle, and Anna Jordan, who runs a child safety initiative in Ireland. So you will see the links to register for that event available in the chat right here. So that's our next event. And the last point, of course, is that this recording from today's webinar will be available, and you can watch back and share with your colleagues from the SafeHabitus YouTube website. So on that point, I'm going to finish up. I think we're just ahead of schedule, and I'd like to thank you once again all for your time and the efforts that you put in today. Thank you.
Thank you, colleagues.